Welcome, everyone. So it's great to see so many of you here. I'm delighted to bring you this talk, which is part of Disability History Month. So there are other events as part of this series. If you'd like to look on the Equality, Diversity and Inclusion web pages, you'll see some other events. But now for today's event. So a little bit of housekeeping first. As you can see, we're on Zoom webinar. So at the bottom of your screen, you'll see there's a little Q&A. So during the talk, if you like to ask some questions, click on that Q&A button and type in your questions into the chat, and then we'll come back to those after the talk. You'll also see at the bottom of your screen, there's a CC button, and that will be closed captioning. So click that if you want to see the closed captioning. And I've got a big thank you to AI Media who are bringing us that facility. So now I'm very excited to welcome Dr. Ossie Stuart to come and talk to us today. Dr. Stuart is an academic researcher and an independent equalities consultant who's written key works on race, disability and social care. He spent 12 years as an academic at the universities of Oxford, York and Surrey, and has written seminal works on the experience of BME disabled people and social care. Dr. Stuart is a disabled person from a Black and minority ethnic background and an equality and diversity consultant with 15 years of experience as a trainer and specialist advisor. As a trainer, he's run disability and equality and diversity training courses for public sector organisations such as the NHS, the Department of Health and Social Care, numerous local authorities, universities and voluntary sector organisations. He also firmly believes that we're all entitled to fully participate in society and have control over our own destinies. And these two ideas have heavily influenced everything he's done, and he says he will do in his working life. So I'm really excited to hear all about this. So I'll pass you over to Dr. Ossie Stuart, who's going to be telling us about access for whom.
Okay. Good afternoon or good evening, everybody. First of all, I'll thank you, Penny, for that very forthright welcome. I appreciate that. I'm very excited to be here today because the topic of access has been on my mind for a very long time. In lots of ways, I think it defines people as citizens. If you have no access to the environment you're working in all sorts of ways, whether physical or just in terms of being acted as a citizen, you're not really considered to be you're not part of the society we operate in. So I think access is key. And so I'll be talking about that today. I've got about approximately 40 minutes. What my plan to do is talk about 40 minutes on my ideas around access and why I think it's so important. And then I'll give you about 20 minutes an opportunity, 20 minutes to talk about questions and answers and anything that strikes you from what I've said. Okay, first of all, let's talk about what I'm going to actually talk about. Let me get my computer where it goes. Firstly, I'm going to talk about four things really. Universal design, because that has informed the way we think about access in Britain today. And but I want to ask really a question, who is universal design for? What's the purpose of it? How it's created and what's the underlying assumptions behind it? What's the problems with the universal design? And is meaningful access for all possible in Britain today? Now, why is this important to me today? I'll go back to 2012 and the Paralympics. That's actually me, with my PA, staying in front of that monstrosity, I can't remember what it's called now, but you'll recognize it, down at Stratford in Olympic Park. And that's the photograph I took of the stadium I was in. I was very lucky to be there. That's actually a theme I'll come back to as well, to actually participate as a member of the audience in the games in 2012. And I remember being struck by how easy the access was. I really was impressed by the way in which people in wheelchairs in particular, and other types of disabilities, who were physical disabilities these were, who were able to navigate the spaces designed at that time. And I was I saw this as a precursor of the future, inclusive design, equal participation, choice and control, being in control of your lives and being a full active citizens, being able to support, the country as we do athletics, all sorts of things like that. And there's me enjoying a stroll in the park afterwards, which I thought was at that time perfectly designed for wheelchairs at the least, and probably other types of people with disabilities too. And in lots of ways, it was lauded by the government at the time. And I would have agreed with this at that time. London 2012 Olympics captured the attention of the country and demonstrated that disabled people who have the same access to buildings, sporting building stadiums as anyone else, which we saw with award-winning Olympic Stadium, where so many memories were made. And I still have memories, good memories at that time too. By putting inclusive design, and I emphasize inclusive design, at the heart of what we do today, we can create an entirely inclusive society tomorrow for the 12.2, probably a bit more than that now, disabled people in the UK to participate in everyday aspect of modern life. Now, for me, I would have been, yep, I recognise that. That was Minister of State for Disabled People, Mark Harper in 2015, reflecting on the success of the Olympics in terms of disability. And so there was, I felt at that time that we probably began to crack it in terms of accessibility. How wrong I was. Two things really made clear to me that actually the illusion of accessibility, the illusion of inclusion, illusion of inclusive design was just that, an illusion. Whoops. First of all, that is an Amazon delivery to me, because I was now in isolation. This was taken about a few weeks ago. I'm in isolation, shut down, and I was dependent on deliveries from the state, from anyone to, for my supplies, food, whatever, deliveries, whatever. And what they were doing now is running up to your house, dropping the parcel on the floor, if I do, ring the bell and run away. Now, I can't pick it up. And it's been an immense frustration and fear when I hear the doorbell ring, and I know I've gotten due a delivery from anyone. Not just that, suddenly my access to supermarkets, because of the social distancing and the rules that govern those environments now, suddenly has been curtailed dramatically. In many ways, during that March shutdown, I barely ever went out at all. I have a car, and I've just discovered the battery's gone flat because it hasn't been driven because I can't go out. Suddenly I feel that all the access I felt I gained had been taken from me. But that wasn't just all. All I felt about this was just frustrated and angry. I thought, oh, it'll come back. But another event happened which made me rethink this. I was asked to attend a talk on green parks, contested spaces around parks. They wanted me to provide a disability perspective on access to parks and how they're contested. And I found this interesting, particularly Bridget Snaith, who was there. She gave a paper called Parks, Green Spaces, Does Everyone Feel Welcome? Weeds, Wildflowers, and White Privilege. And you can find that at the Shape Landscape Architecture website if you go, 2012 it was. The main point she made was this: park designers' cultural preferences are identified as legitimate, moral, and rational. Therefore, the people who design those parks design it for themselves and the people they relate to. Other cultures or religions are trivialized, to be ignored, represented as immoral, or denigrated. In London, for example, including Olympic Park, by the way, in areas where 40% of non-white communities live, there is 11 times less green space compared to areas where residents are largely white live. That isn't just by accident. That's a decision. Somebody's making decisions about that. Blame for underrepresentation in these parts from minority communities is actually blamed on the people themselves. And she said finally, there's a stronger relationship between ethnicity and patterns of park use than income alone. So it's not about poverty. It's about legitimate, illegitimate. It's about power. These are more profound than just about whether we can just get in the park, get in a car, go somewhere. It's about who decides. How are they designed? Who's driving that design? So that made me think about this concept of universal design and also the Paralympics again. Thinking about reflecting on that, I would say definitely that this was not a value-free environment where anyone could go to. But I'll talk about that a bit more in a minute. Universal design is a way of designing a building, facilities, or facility at a little or no extra cost. So it's both attractive, functional for all people, disabled or not. The idea is to remove expensive special label from products and designs for people with mobility problems. And at the same time, it eliminates institutional appearances of many current accessible designs. That's a guy called Ronald Mace. That was a book called Barrier-Free Design, Environments for Everyone. He wrote it in '85. It's been very, very influential. It was also refined to actually be less generalized in these seven main points, which summarize universal design. It must be equitable. That means useful and marketable to people from diverse abilities. Flexible in use, accommodate a range of different individual abilities and preferences. Simple and intuitive, easy to understand regardless of user experience, knowledge and language, skills, or current concentration levels. Perceptible information, communicates necessary information, necessary information. Easy to use, easy to understand, and regardless of ambient conditions or user sensory abilities. Excuse me for that. 5, tolerant for error, minimizes hazards and adverse consequences of additional or unintended actions. Low physical effort, can be used efficiently and comfortably with the minimum of fatigue. And finally, size, space for approach and use. Appropriate size and space is provided for approach, reach, manipulation, etc., like that. So that's basically what sums up universal design. It differs from inclusive design quite subtly. British Standard Institute defines inclusive design as the design of mainstream products and services that are accessible to and usable by as many people as reasonably possible, without the need for special adaptation or specialized design. So you can see similarity. However, universal design is underpinning ethos of inclusive design. However, has been criticism of the 7 principles being too vague and to be applied practically in practice. The problems that occurs in built environments are complex and often interlinked. Each stress access for all, by the way, not just for disabled people. It should benefit everyone. So universal design and inclusive design, although it started out from a disabled person's perspective of good access, is actually now designed for everyone. The idea, it shouldn't be just for one person. There's been criticism from disabled people about this. And I'm going to take Colin Barnes and Amy Hammeray's papers who've looked at universal design and made some observations about it in terms from a disabled person's point of view. Colin Barnes, you probably many of you will know him. He's an academic, been an academic for many years at, I think, Leeds University. He's very interested in, obviously, in the social model of disability. And he sees universal design as coming from that radicalism. 1970s, disabled people from United States, United Kingdom, began to agitate for rights and choice and control and the right to be treated as citizens. There was, as a result of that, there was a shift from seeing disability as an impairment to a form of social impression. And Mike Oliver's famous phrase was coined in 1981, described it as social model of disability, where it provided tools and insights into disabling tendencies in contemporary society in order to generate policies and practices to facilitate its eradication. So a focus shift from the body, the social environment, in terms of what oppressed disabled people. It elevated debates about the importance of accessibility and also generation of accessibility and universal design. So in many ways, what this was doing was helping to drive a rethink about accessibility and also to inform how design should be to include disabled people. But for Colin, it's not really about the physical access or the environment, because he pointed out, obviously, there are so many different sorts of experiences as a disabled person, and the different ways disabled person can be impressed because of that. So for him, the primary keys of independent living for disabled people are peer support and personal assistance. So really for him, it's about people, the human involvement with disabled people that is key. You can't access the environment if you don't have that interdependence between people. Now, of course, I concur with a lot of what Colin has had to say. Social model of disability has defined the way I think about disability in the first place. It changed my life, basically. However, I think there are some limitations from to his assessment of universal design from a disabled person's social model point of view. And I think they really are. There's no discussion of value. What I mean by that is the power behind design. Who is it? Who is the access for? In his work, he tends to take as given is that design is just there. It is value free, but it just needs to be argued that disabled people should be part of that environment too. I think it's more complex than that. Also, his work tends to ignore what I call intersectionality, which probably you all know is about the whole focus on the impact of different, people are people of different identities, different parts to you. But some people are experience discrimination in different ways because of who they are. So I'm a Black man, for example, and a wheelchair user. So I will experience discrimination and exclusion in different ways to somebody who's white. So it's important that, but Colin ignores this really. The focus is on the impact of discrimination on disabled people as a group. Other groups and other experiences other than disability are ignored in his work. So despite his intentions, this reinforces a rather exclusive, rather inclusive idea of universal design. What I mean by that is this: he doesn't challenge the overarching narrative. Who's designed this? What's the context? Where does the power lie? And what is legitimate and what's illegitimate? This is why I like Amy's work. She takes a disability feminist perspective. And I've always reached out to those perspectives because they tend to be much more nuanced in terms of understanding what's going on in terms of disability. But what she does point out is feminists who's written about universal design tend to write about it from either ethnicity or from gender, but not disability. And she's been critical of other feminists who simply see disability as almost like a medical model thing where people have needs to be met. So there have been the few feminists, disability feminists who've written about universal design, she's summarized here. And I won't go through them all, but I've picked out these 4 points I think are very important. She obviously, like the quote at the beginning, built environments are not value neutral, but serve dominant identities and bodies. What she means is that the designers design them for themselves, and they serve the dominant identity. So they relate to themselves. That built environment is largely a creation of white, masculine of subjectivity, patriarchal values. A failure to value marginalized minority bodies and ethnicities have the effect of labeling them as misfits to be fitted in. So no matter what, because of the dominant narrative, disabled people and other marginalized groups, other misfits, in her, to quote Amy here, I stress, always having to be fitted in as an afterthought. They're never invited to the table. And this includes co-production too. Co-production isn't value-free either. Who you choose to be part of that group tends to reinforce that dominant narrative and reinforce that idea that there is a right way to do things and a wrong way. And then also it's a negotiation between like-minded people, so to speak. I've been involved with co-production quite a lot, and my major critique of it has been its inability to relate to intersectionality. Finally, she's critical of added value assumptions, universal design. What this means really is that added value means that basically, if you do something for disabled people, everyone else benefits. So for example, if you think about Sainsbury's and you walk in, electric doors open automatically. That really is great. I love it. Electric doors, disabled people can get in easily, but other people can. So what you do is you argue that if you do this, it actually benefits everyone. So it's not just about disabled people. The problem with this is, as Amy pointed out, it tends to turn disability into consumer benefits to serve the validation of the dominant narratives. So we make those changes not for disabled people only, but for everyone. So basically, it takes disability out of the center. It turns it into just one thing you do. As one feminist theorist said, to adopt disability justice notions to collective access is the only way to change this. So what they mean by this is that we need to take commercialism out of this and make it a necessity because it's good for society overall. So those perspectives would be very helpful for me to think about why my Amazon box ended up on the floor and not in my arms. Because actually I'm being fitted in. And as soon as the crisis hit, I was no longer fitted in. I became inconvenient and ignored. The myth of universal design was clear for me there. But I want to go back to this concept of value and power, because I think this is key to understanding what is the problem with universal design or access in general. Supermarkets, shops, museums, parks, public toilets, all these places, McDonald's, if you want to use those places, are not value-free spaces. In this picture, I've got two images, one of a person begging outside Tesco's and the other one actually person shopping in Tesco's. How they look, how they behave determines whether they are seen as legitimate or illegitimate. And how they're treated in those spaces determines that as well. And that applies to any of the, quote, misfits who have not been included in the way that shop has been designed. All you've got to do is look at every single advert for any accessible, any building, any place, and you tend to see, tend to get an idea who are the imagined people who use that. And I can tell you this, they're not the groups I've described earlier. And if they are there, they're there on condition, not as a right. So my criticism to inclusive design and universal design are this. There's a lack of explicit discussion of societal power. We just don't talk about it. Think about the Grenville Tower tragedy. Why were those people living there? How were they treated? What were the decisions made? Who made the decisions? What was their voice? It turned into a tragedy which actually people's lives were at stake. Structural inequalities demonstrated by Black Lives Movement demonstrates that there are some people, because of who they are going to be live in a society which automatically excludes them. The fact that we had the health inequalities were so disproportionately impacted on both minority communities and disabled people tells you something about the experience that how people are marginalized and how they experience this way society operates. So there's the contested, monitored, and conditional access for and among disabled people and other groups as well. So we got disproportionate deaths for people from minority communities, evaporation of support during COVID-19 for disabled people, all points to a structure that excludes and discriminates and undermines inclusive access, and inclusive design. The one criticism I had of Colin's work was about the lack of diversity within disability. And this is actually a very important point to make too. Because when we think about inclusive design or exclusive or disabled people, we tend to see them as a group, and they're not. And I want to give you one statistic before I end to show you how stark the difference is between experience of some disabled people with others who apparently appear to be similar. These are distressing figures. During the COVID-19, the first wave of COVID-19, people with learning disabilities who died after contracting COVID-19 was 6 times higher, 6.5 times higher than anyone else. So for 690, that equates to 692, there was 700 for every 100,000 people, or 6.3 times UK average. People with registered learning disability died in the first wave of pandemic. And the virus accounted for 45% of adults with learning disabilities in residential care during that review period. This is from Public Health England, by the way. And also 53% of deaths of those receiving community care. Now, I know you'd be thinking, okay, what's this got to do with universal design and access? Well, it's everything to do with it because it's about people's lived experience and being treated appropriately. Access isn't just about doing things, it's about information, it's about treatment, it's about good healthcare. It's all these things that make us who we are and good citizens. However, when we think about people with learning disabilities, it would be a mistake to think about them as one single group, which we tend to do. To show you what I mean, excess deaths in 2020, these are more people than were expected to die, by the way, from people with learning disabilities. So 4.5 times excess deaths for people with Asian people with learning disabilities, 4.4 times higher for Black people with learning disabilities, and less, 1.9 times for white people with learning disabilities. So even within this group of people, we describe that there's a disproportionate experience. We can't account for that purely bound to health or biology, because let's be clear, these people are just people. The experience is what it is. All we can say is that there's something going on where people on a subtle level are being treated less favorably or have less access to good services, etc., than other people, where they live, medical experience, how they're treated, etc. So when we come to look at the differences between people, we need to think very carefully about who we're talking about, and when we talk about labels like disabled people or groups, etc. This is a quote from a father whose son died during COVID-19, his experience of this. And this person isn't from Black community. He was talking generally about this experience. But it gives you an insight into how subtle this experience can be. The doctor initially failed to diagnose COVID and gave him antibiotics for a suspected stomach bug instead. When he was admitted to hospital, my son said he was denied treatment on a ventilator. These are access issues. Access to hospital, access to good healthcare, access to a ventilator. I got the impression that the normal patients, as this is a quote from the parent, that normal patients would have gone on to a ventilator, but he was just allowed to die. I do think health services failed him, he said. We should have had an explanation from the doctor on why he couldn't have any more treatment. That was in the Guardian 2012. Now, that could have been anyone from those groups of people. But if you think about that quote and then overlay race on it, so those micro decisions, failing to diagnose, unable to communicate properly, English not first language, refusal to decide not to give him antibiotics, make a mistake around treatment, decision not to even admit to hospital, and then denied treatment on a ventilator. It's very easy to see how inequalities build up. And this is why it goes back to that point at the beginning, where when you have a dominant narrative that doesn't include certain groups, then it's very easy to make decisions which exclude them, intentional or not. Future access. When I've been thinking about this, I'm thinking, okay, I've got to say something positive about this, and it's pretty hard to do so when you are very frustrated in your house and you're beginning to realize that actually there was never such a thing as inclusive access. And in 2012, I was living an illusion. I won't say living a lie, but living in a bubble of my own. Access is not value free. It is contested. Every arena is contested. That's always conditional for the misfits. What this means basically is this. When we go into shops, supermarkets, cinemas, these are not value-free environments where anyone can come. You're invited in or you're excluded, depending on who you are, how you look, how you walk, how you smell, how you speak. And that dominant narrative tends to be white male. And the fact we don't notice it, or people don't notice it, is what we call white privilege as well, by the way. It's not that anyone's privileged, that we don't, many people don't experience what disabled people and people from minority communities do. We need to acknowledge this and make explicit the role of power in when we're talking about spaces, environments, inclusion. You can't, I don't think you can start a conversation without first talking about that. Universal design, and it is a good thing, by the way, and the idea that we have it, the concept, and we are challenging the idea to make people think about design, inclusion, is that, but it's only a very small first step in the right direction. But it needs to be cited in the concept of power. Who has it, who doesn't have it, and who's going to give it up, and how do we change that power dynamic? Until we begin to acknowledge how privilege structures access in our society, barrier-free access will always be an experience of the privileged few. Disabled people themselves need also to reflect on how they will ensure that everyone they describe as disabled people are included. It took me a while to get there, but I now know why my parcel ended up on the front step at my house where I couldn't pick it up. And it has a lot to do with the narrative around, how we think about value, how we think about power. I have no value as far as Amazon is concerned. I'm not important enough. Therefore, the parcel ends up on the floor. Those who do have value are those who can navigate this particular design of parcel delivery and gain the access to their parcels. I have to watch my parcel get soaked or get nicked, or both, because there's nothing I can do about it. That is disempowering, it's humiliating, and it's frustrating. So when we talk about universal design, I think we need to start with that discussion about power and who is it, and also more importantly, who is exactly is access for all for? Thank you very much indeed. Let's get out of that. Yep, did it.
Excellent. Thank you so much. That was a brilliant and very sobering and moving talk. Thank you. I've got a couple of questions for you. And if anyone else in the audience, if you just want to put the questions in the question and answer. So Phil Chambers says, most London parks are Victorian or before, and I've worked at several parks in urban areas with mixed populations. Lloyd Park, Horniman, Finsbury Park, and Lordship Recreation Ground, where I've promoted universal design. So I feel your assertion is a bit unfair that we're designed out. I'm a wheelchair user. So that's from Phil. Oh, you
I'll
have need
respond to that in a minute. Yeah, done it. Try to respond to that now, or should I respond a bit in a minute to get two questions, and I can respond to sort of one then the other, I think.
Okay, I'll give you, there's two questions. Okay,
Yeah.
I'll go into the next one and then perfect. So also there's a good point about the diversity of need amongst disabled people, and often a wheelchair is the default group. How do we change this perception?
Can you repeat that question?
Yeah, so good point about the diversity of need amongst disabled people, as often the wheelchair users are seen as the default group. So how do we change that perception?
Yeah, that's a good, two very good questions. I'll take the first question first, of course, because it was well put, and I agree. Now it's interesting you raised that about saying that parks are not a bit unfair because of the way they're designed. What I was really talking about is this, and I'll give you an example of this. What we're talking about here, and this is around race, not necessarily disability, is that what park designers are realizing now, self-critically, is that parks send major signals to who is included, who is not, how they're valued or not. I'll give you a simple example. If you go, I think you mentioned one of the parks I know quite well. One of the parks there you mentioned, I can't remember which one it was, so I'll go back to that in a minute, has a big problem where young men, white males maybe, bring dogs which are unleashed into the park. What happens is that Asian families have to leave the park immediately because of that. They do it deliberately. So what we're talking about here is belonging, and those people won't use parks anymore. They choose not to use parks. So we're talking about values here, about what's the park for, who's it for, not whether it's accessible or not or whatever, but who is it for. Now I know there's some Asian families who are disabled people, wheelchair users, who won't use those parks, not because they can't get access to them, but because of the value base on that park. It's not for them. They're excluded. That's the point I was trying to make. So that's why I'm putting the challenge to us as a disability community to start really thinking about what's going on here and what does intersectionality really mean. Okay, and so second question was, so I think that's all linked really. I think we need to have an honest discussion about when we talk about disability. And I agree about, I'm a wheelchair user, and I agree with, when I go to an event, I see 25 wheelchair users in the room, all shouting. I think, oh my God. Oh, yeah, because there is a power dynamic there too. And it's a similar one, I think, with our ethnicity, voice. It's about voice and how we think about inclusion and who we're including, who we're not, and how we manage those things. And I think we need to be very alive to this, to a point where we need to be self-critical. I've not yet had, I gave a Black Lives Matters talk on disability in London recently, on Zoom, of course. And I had a lot of CEOs from disability organizations come up to me afterwards and said, Ossie, we've got a problem. What do we need to do to include, how we better include disabled people in minority communities? So there is a discussion to be had about that.
Thank you. So Phil just had a comment back again from what you said before, and then I've got another question from Marilyn. So Phil said, yes, I've raised that about dogs and Asian families with LAs before. So yeah, with local authorities, that must be, yeah. Sorry, that was me being dense, thinking, what's an LA? Now I know what it is. I've worked that out. Sorry for that. Okay, and then Marilyn says, thank you so much. Can you comment on how to effectively challenge the way that city centres around the country are being closed off to many disabled people / blue badge holders following lockdown, including here in York, and justified as being part of excluding cars, a green policy, and deterring terrorist attack in shopping areas?
Yes. Okay, I totally agree with you. I am Camden, I'm down in Camden, by the way, and they're doing exactly the same thing. However, what we're doing in Camden is beginning to lobby, we're actually lobbying the local authority directly, chief executive, downwards, and actually getting them meetings and talking about power, control, in consultation. And I mentioned the word co-production and consult. Have you actually co-produced this? Have you thought about getting people involved in those bits of policy, not whether we can get a toilet or not, or social care system, but those fundamental things like access to the built environment. So I think what I would say back to you is that you need to it has to be political. These are political things. And it's all about social justice. So you need to take a social justice perspective on this. You have a right to access that space. So those people, local governments have to understand that. best I can say, but it needs collective organization, basically, which is putting it so simply.
Perfect. So Lauren, following that, says, can you elaborate a little bit about the exclusion from public spaces, especially green spaces, and the impact on mental health, especially for Black and ethnic minority communities? Do you think this intersection is addressed enough?
Yeah, no, last bit of the answer is no. And secondly, absolutely not. And I think you're right about mental health, and that's why well-being for not just, and I go beyond minority communities because it affects everyone in lots of ways. There has been a real problem about accessibility to green spaces. In London, and I live in London, is a massive contest around access to green spaces. Who's it for? And when there's meetings and committees to talk about redesigning or changing something, you'll see a certain lobby come in. I won't try them too much, but they're older, certain type of people and certain type of color who dominate that discussion. And their priorities is to exclude other people. So this is a real political issue here about rights and responsibilities. And the other thing I'll say as well, during lockdown, if you were in Primrose Hill, which was crowded, by the way, during lockdown, the police didn't take blind notice. You were in Streatham on the park there, many Black communities, Black kids. Police were there in numbers to clear the park. What's going on there? So there are issues around politics and power. I would say that absolutely.
Absolutely. So Ellen also says, there might be some more questions, but this is the last one for now. What do you think about providing access for autistic people and people with invisible disabilities?
Oh, wow. That's my biggie. If you can't address, this is why I go back to that narrative about masculinity, power, patriarchy, etc. Because a lot of people are excluded because of that. So it's about changing how we think about what we're doing, why we're doing it, what is that space for, how do we think about that space? Like if it's shop, whatever it's designed to do, what's it for? And because at the moment it's been designed with a set of assumptions which exclude those groups of people. Visible or invisible impairments, doesn't matter. You're excluded because things are not efficient. And if they are put in place, it's an afterthought. You are inconvenient. So it's about starting from the beginning and going for what I call nexus of power, thinking about the architects, thinking about the local authorities who design these things, who give a power function. It's a discussion, it's a debate. And you've got to start somewhere. And I was very pleased about the discussion we had with the architects I was involved with, because it was a lot of people there who actually, the guy actually designed Olympic Park was there, and he got a bit of a hammering, but he said, yeah, you're right, absolutely right. I made certain assumptions. I didn't think about it.
Oh, that's brilliant. Okay, I've got a question. So what can we do then? What can we say as a group of people with disabilities, or what should we be doing? We've had this experience whereby I think, as you've shown, it's sort of very well, lockdowns often affected many people with disabilities in some really quite negative ways often. And it's highlighted lots of social inequalities. But now we're just at the point, I think, aren't we, where we're thinking, okay, we're starting to look forward now. We can see these vaccines coming. What do we do at this point? What are your sort of recommendations for the future?
There's a big ask, but I'll throw a couple in. I think there's learning here. We've learned a lot from this, and we talked about it started about the learning we're going from this, and that we like what the gains were. Although I don't like value added, there are tools you need to argue with about why we need to change the way we've been doing things. What we did before is unacceptable. It's not acceptable to tell people, it's acceptable to everybody else. So there needs to be a way we debate this on a micro level with the universities or colleges or students or whatever it may be, or it needs to be a macro level on councils and local authorities, whatever. I'm actually talking to government. I have access to government, which is amazing. And they are aware of the things that went badly wrong for disabled people and things they can do better. But there have been benefits as well. We need to keep those as well. There's no doubt about it. I know one thing in Mind we're talking about, sorry, MenCat we're talking about how disabled people they've not spoken to for years because they created a Zoom way of communicating, suddenly participated in meetings they've never done before. So they've realized they've got to give a blended service in the future. So they've really learned from that and say, we can't just go back to business as usual. It needs to be different. So there has to be learning on lots of levels on these ways. But in the end, it has to be a wider discussion amongst the disability community about what we want in the future and understand what the real problem is, and it's power. It's people who make decisions without us being in control of that.
Yeah, that's incredibly insightful. Just let me check down here. Yep. Yep, it's it. Phil said engagement with disabled people on their own terms.
I think so. Phil,
yeah,
agree
I think
with it.
everyone can agree with that. Okay, I'll just take. Okay, I'll do this as the last question for you because I don't want to hold everyone here too long. But one last question from Elva. Several disabled people have noted that accommodations that they requested in the past, e.g., virtual attendance at meetings, have now been made available for everyone. Do you think that some of these benefits can be carried forward, and which benefits should we focus on?
Yep. Okay, the benefits you should focus on ones that work for you. That's straightforward. And also work for other people you know who are disabled people too, because I'm doing that too. I mean, it's certainly going to be a case that you focus on that. But it is interesting that value added, i.e., if it benefits everybody, disabled people can benefit too, is good and bad. It's a problem. It's good because we get access to stuff, we can do it, but it's a problem because it's always seen as it's not us who've driven that, it's other things that's driven it. And that's a power thing. So we need to be thinking about how we can exploit that in a way that suits disabled people too. What I would say to you simply is, if you think about what you've benefited from the COVID-19 shutdown, I've benefited from it too in some ways, and I will be now advocating very firmly that I will be continuing to do that. I do a lot of face-to-face training. I'll be doing a lot less of that going forward in the future, but I'll be doing a lot of training. So it's about making sure that your voice is heard and being confident enough to say, we're not going back. No, I'm not going to do that. We don't need to do that. So it's about your confidence and your learning.
Okay, thank you very much. I think that's a brilliant place to stop there because that's a really inspiring point for all of us. So thank you from everybody. I think we really enjoyed that talk. And thank you again to AI Media for the closed captioning. Thank you very much. Okay.
Bye-bye.
Bye.